Hi, welcome to the section of cardiology. This is Dr. Jaitly. Here I'm talking to you about what are the causes of heart failure in this video clip. Well, there are numerous causes of heart failure because heart failure is such an increasingly important condition right now all over the globe. It's almost like an epidemic, and one, because the population is living longer, happily ever after. Two, people are not dying from early because of, say, heart attacks because of the huge advent of technologies and medications and sophisticated equipments to support the heart attack victims. So invariably people die of failing heart, not of because the heart now ages. And because we're getting older, so age is a huge factor, so ultimately the heart does get weak. And so let's define what heart failure first is. Heart failure occurs when the heart is not able to meet the needs of the demands of oxygen for itself or for the rest of the body. So when the function of the heart is not able to meet the needs of the demand of the body, that's what is called heart failure. So in other words, say there is X amount of oxygen that needs to be delivered to the tissues and the heart is not able to meet that, even in the circumstances where the person is resting, it's defined as heart failure. Now, you may have higher metabolic rates, you may have higher demands because of, say, a severe infection, and those things could be transitory, like for those few weeks or few months that the condition is existing, and yet somebody can have a heart failure as a result. But those are much reversible, obviously, because once the infection gets better, things do get reversed. So let's understand now what the various causes of heart failure here is, just the basic aspect of it, and we'll delve into these conditions individually later on. But just so that you know, the heart has myocardium, which is the heart muscle. So there's a hypertrophic cardiomyopathy. Look at it this in the left schematic. Here's the septum, and this is the left ventricle, this is the right ventricle. So when the septum enlarges and obstructs the aorta right here, so the aorta is not able to push, it's called hypertrophic idiopathic subaortic stenosis, IHSS. It's a long term, but just remember there is a hypertrophic kind of cardiomyopathy that can occur. Now it could be concentric or it could be eccentric, like the one I just told you. Then there's a dilated cardiomyopathy where the left ventricle just dilates or gets bigger. Nobody knows the causes of these, but the fact is that, again, some genetic predispositions are there, some chromosomal disorders. Systemically, diabetes and hypertension can cause heart failure. Then there are infiltrative diseases like sarcoid and hemochromatosis. Just to remember these terms for now, because obviously we'll delve on these things later on. Infection, viral infections can cause significant heart failure rather acutely and normally preceded by a viral illness for 7 to 10 days. There's a prodrome, the patient feels like he's got a significant flu or cold-like symptoms, and then after that it's followed by this weakening of the heart muscle. Postpartum has been reported in some individuals where the lady delivers the baby and then following that has the weakening of the heart, and it normally manifests in the first few weeks after the delivery, and again the mortality is very high and it tends to recur in future pregnancies again. So again, once the woman has had postpartum, we call it postpartum heart failure, the advice is not to get pregnant again, because the chances are your heart will further be weak and may not be able to sustain or the next pregnancy, etc., etc. So it's a high-risk situation there. Lungs like cor pulmonale, especially from smoking mostly, or COPD, or even chronic bronchitic or asthmatic conditions, can eventually lead to the right-sided failure. This is the right-side failure, and that's called cor pulmonale. Ischemic is lack of blood supply when the coronaries are obstructed. So this area, if it is affected, then that's regional ischemia. If the entire heart is affected, it's called global ischemia. Valvulars, any of these valves, like the one I've showed you, the tricuspid valve, the mitral valve. Now, importantly, mitral and aortic valve, these are the left-sided valves, which are very important. That's why I've said MR, mitral regurgitation, aortic stenosis, or aortic regurgitation, or even IHSS, like I told you, have a hypertrophic cardiomyopathy type of valvular condition. High output failures, where the failures requiring high demand and not able to meet the demands, like in anemia, for instance. The hemoglobin normally should be about 14 to 16 grams, percent, and the person is chronically anemic, low hemoglobin. The patient has to pump this heart faster and stronger, and as a result, it's called a high output failure to meet the needs of the oxygen. Hyperthyroid, where the thyroid is too active. And then when you have AV shunts, where there's an external shunting going on, like in renal dialysis patients. We know we have internal congenital shunts that can develop, like in the VSD, where there's a hole in the septum in the ventricle, or there's a hole in the atrium here between the two chambers. So these are congenital shunts. These are intracardiac shunts. But the extracardiac shunts, if you will, are the ones where, like the AV shunts from renal dialysis patients, where the shunt is created in the arm to support the renal or kidney patient on dialysis. Poisons, alcohol and smoking. Remember, these are obviously modifiable. If somebody quits alcohol and quits smoking, the chances are the heart will return back to normal. But otherwise, the heart eventually only gets weaker and weaker, and there will be a point of no reversal, and as a result, then it's permanently damaged. So poisons, definitely alcohol and smoking, are the causes of heart failure. Arrhythmias, like fast arrhythmias and slow arrhythmias, or fast beats and slow beats, if they're persistently long enough for several weeks, etc., that can lead to weakening of the heart. Then there are genetic compositions or genetic reasons where it's normally accompanied by other muscular dystrophies and familial conditions. Those will be manifested, and there's normally a family history of that kind. Chagas disease is it's secondary to an infection that occurs in South America, and that's very prevalent there. And then the idiopathic, where there is no cause that's found. So anyway, these are some of the reasons why a person has a heart failure. We'll be talking more. I know this is a very exhaustive list here, but not to confuse you, just to enumerate you in this one. And I had to move a little faster on this one, so I apologize for that. But in any case, I think I covered most of the causes of heart failure here in this video clip. And we'll delve on individual ones as we go along in the future sections. Thanks so much. Have a good one.